Good morning, students. Today we will learn about the legal and ethical aspect of the midwifery and obstetrical nursing. Okay, so in previous session we already learned about the key terms, then the qualities of the midwife, historical perspectives, then trends and current issue in the obstetrical and midwifery nursing. Okay, and role of the midwife. Now, today we will learn about the legal and ethical aspect of the midwifery and obstetrical nursing. So, what is the law and what is the ethics? Okay. So, law and ethics are often seen as a complementary to each other, but at the same time are also seen as the opposite side of a coin. So, midwife must follow the standard and regulation that range from the national level of the individual area of practice, such as a hospital, labor, and delivery unit. Okay, so nurse and midwife have to follow some standards and regulation that is called ethical rules. Okay, and legal and ethical rules have to the follow by the midwife. Okay, whenever in the area of the practice where she practice their license or quality of the care, such as hospital, labor, and delivery unit also. Okay, so what are the legal and ethical aspect of the midwifery and obstetrical nursing? So in legal and ethical aspect, there are many legal and ethical aspect are included here. That is, the first one is the national standard of practice, then state license, next negligence. Okay, so these kind of the aspect are included here. Okay, so first of all, national standard of the practice. In that, various level of the legal regulation and standards are defined by the midwifery practice, but national standard are provide an expectation of delivery care, because every woman expect the high quality and best quality care to provided him and her newborn baby. So in that case, the national standard of the practice is applied here, and the educational program of the midwifery assured that all new nurse midwife can safely deliver a care within the scope of usual midwifery practices. Okay, so in this point we only remember that the various level of the quality of care and legal regulation are given to the midwifery practices. Okay, and in that we will include the high quality of the care and delivery care to the provided to the patient and her newborn also. Then second point is the state license. Okay, so every midwifery has a legally licensed and practice in a under the ICM norms. Okay, International Council of the Midwifery. So in that case, he or she regulated in the state of practice through the license or to a practice, and if midwifery practice in a two state, she must be licensed by the both state. In this point, we remember that every nurse has a legally license, but which kind of license, that is the comes under to the ICM norm. And if a person or midwife has a two state license, then she has to must be licensed by the both state. Okay, not only one state or one license is applied or legal. State license is a mean to be protect the consumer by ensuring the midwife has appropriate education for the profession and can provide the safe care. So, what is the benefit of this state license? Because if any case of if any case a midwife have legally right for the her protection. That's why the license is a must needed. Okay. Next one is the community standards. It tells a midwife's duty must be evaluated according to the availability of the medical and practical knowledge. Okay, so would be used into the treatment of the similar patient undergoing some circumstances by competent midwife, given the facility, resources, and opinion available. Okay, so community standard also legal comes under to the legal and ethical aspect. Next one is the institutional policy. Obviously, a midwife is practiced under whenever it institute is situated, but the institute has a special policies. Okay, So the hospital have also special policy. In that case, hospital laws govern midwife working in that hospital. So the midwife working in the hospital should review the policy of that unit and in which midwifery care is provided. So this is the legal and ethical aspect. The next one is a professional negligence. So what is the professional negligence? Medical malpractice is the legal error committed by the medical personnel. But in legal terms, this error is tort a civil wrong that injury a person. If a tort is institutional, intentional, then it comes a crime of the assault or battery. Negligence, a form of malpractice, is an unintentional tort. Okay, so the negligent are four elements of the negligence. That is, a duty must exist between the injured party and the professional accused of the wrongdoing. Okay, so if any wrongdoing is there, then a duty must between the injured party and professional accused. Okay, so a breach of duty must have occurred and the midwife must have practiced outside the standard of care of the breach to occur. Then the breach of duty must be proximate cause of the claimed injury. Now in key terms we already learned that what is the breach of duty. Breach of duty means failure to the following some legal and ethical aspects. Okay, so in that case, we can't, if a failure of the following that legal and ethical aspect, the negligence may be arise. Okay, there must be a damage or injuries to the claimant that are recognized by the law and compensable. Okay, so these all five are the legal and ethical aspects. Okay, now we will see about the legal issues in a obstetric and gynecology. So what are the legal issues arise in today's world? Many legal issues are involved in the obstetrical and gynecology, but lawsuits against the nurse include the following. That is the problem of medication, failure in monitoring of the client, then failure to report change into the patient, failure in assisting the client, abortions, nursing care of the newborn. These are the problem. Okay, issues of the in today's world, legal issue. So problem of medicine means if we, nurse provide a medicine to the client but wrong medication or given to the wrong patient, then it may be a legally problem for the patient and midwife both. So in that case, problem may arise occurring during giving medication, which can result into the allegation against the nurses, such as improper dose. Yes, improper dosage of medication is given or improper client given to the medication, wrong route of the medication, wrong time. So these kind of the problems are faces by the nurse and midwife. Okay, so these are legal issues. So as we know that in medication there are many chances of the wrong medication, improper client, wrong time, wrong route of the medication. So this is under the legal issue of problem of the medication. Okay, next one is a failure in monitoring of the client. So if nurse or midwife is wrong for the assessment of the woman or in monitoring of the woman, so in that case patient have to suffer and nurse have to suffer. So it is the most important responsibility of the nurse to monitor the client regularly. Depending upon the condition of the client, she is expected to monitor the condition of the client and admitted with any gynecological problem. Okay, so this kind of the issue is comes under the legal issue. Next one is a during antenatal period also monitoring essential, because so that any complication is there, we can provide, we can prevent it immediately at the initial stage. Okay, so nurse has to monitor the client during the antenatal, intranatal and postnatal period. Failure of this kind of the assessment and monitoring process, it can result into the legal issue. Okay, next problem issue is the failure to report changes in the patient. Nurse do the regular monitoring and assessment of the client. During assessment, she may notice that the changes in the client condition. This has to be brought to the notice of the physician. With this, precious life can be saved, because As I told earlier, if in the problem of the monitoring or assessment, it can be uh, problem for the patient and midwife also. So do the regular assessment and monitoring of the client and in a proper and systematic way, so that we can save the patient and we can cure the patient at the initial stage. Okay. Next one is a failure in assessing the client. That is the same as I told earlier. Then abortion. In the case of abortion, I perform illegally, but nurses have the right to refuse the assist in the procedure of the abortion. If the abortion is performed under the act of the medical termination of pregnancy, then it's okay. But if not under to the medical termination of pregnancy, then she can assist in the physician. In this, patient who has undergone abortion needs care, monitoring, and proper assessment. Okay, so it is the nurse legal responsibility to care of the such kind of the patient. Means patient who have abortion. Okay, so due to that, patient have to suffer many problems. So this kind of the client have to be if provided any essential care and important quality of the care. Okay, next one is the nursing care of the newborn also. Yes, because not only we can provide an attention to the woman only, but after the delivery of the baby, we also have to take care of the newborn also, and nurse have to manage responsibility of the newborn, that for the assisting woman into the breastfeeding also. So then take the footprint of the newborn, cord is clamped, then wristband, this kind identification, proper warming and the is maintained, etc. So these are many responsibility nurse have to carry. Okay. So these are legal issue of the obstetric and gynecology. Okay. Next one, ethics in midwifery and gynecology. According to Thompson and Thompson, to be professional is to be ethical, and to be ethical is to be professional. Okay. So to be ethical require an understanding of the ethics, moral values, reasoning, and ethical decision making. So the nature of ethics require one to focus on what it means human to be human and how to be interact with the other in respectful manner. Okay. So the goal of ethical midwifery is to do the right thing for the right reason. Because without reason, with doing anything, then it can be problematic for the client as well as the midwife also. So knowing how to make a good decision as well as why these decisions were made constitute to the ethical midwifery practices. So the study of ethics will provide the framework for the exploration and aid resolution of the dilemmas. Dilemmas means the condition in which we can't think any right decision. Okay, so confusing mode is called as a dilemma. So in that case, midwife have to do a provide framework for the exploration and aid resolution. So different people may understand different things from the some words, and so ethics help them to understand and what they think feel about the given solution. Okay. So, a neonatal nurse is professional with the special training, skill, knowledge, and in the care of newborn and family also. Because after delivering of the baby, we have to particular given observation for the woman, also newborn and her family also. So, the neonatal nurse is accountable for the patient, profession, and employer. Failure to the neonatal nurse to meet the obligation can result the liability in the profession and the liability in the employment, civil suit, and criminal convenience. So, what are that obligation? That is ethical principle of beneficence, then non-malefficiency, respect for the autonomy, beneficence for the respect for autonomy in gynecological practice. Okay, so what are these? That is the ethical principle, means ethical principle of the beneficence, that is one to act in way to the expected reliability to produce the greater balance of benefit over harm in the lives of the other. So in that case we have to help the patient and also the newborn baby. Okay. And what is the non-mal efficiency? It means the healthcare professionals should prevent the causing harm and is understand as expressing the limit of the beneficence. Means we have to think about the first patient's right and patient's quality of the care. Not we think about the own self. Okay. So that is the non-mal efficiency. Then respect for autonomy. In this principle requires that one always acknowledge and carry out the value-based preference to adult competent patient. Okay, and the beneficence of the respect for autonomy in gynecology, that is benefit to based on the autonomy, based on the clinical judgment and the gynecological practice. Okay, for example, a woman may present with an ectopic pregnancy. Ectopic pregnancy means pregnancy conceived but not in the normal passage of the uterus or uterine wall, but among of them in fallopian tube or any other way the pregnancy may conceive. Okay, so in that case the gynecological must explain the diagnostic finding and potential for the maternal health, maternal death, and unlikelihood of spontaneous resolution when there is no reasonable alternative to manage the patient condition and the clinical judgment is the benefit based. So example, screening for the cervical cancer by pap smear test and will protect the patient health and promote the health of the interest of the care. So in that this kind of the critical cases we have to think about the patient's health first. Okay. So decision our decision is about the patient's health. And last one is the caring. Caring means health professional usually care for their client and as such as would always their best interest in that mind. But making decision on behalf of others is caring for client because healthcare professional education and training enables that to know best. At same time, it doesn't give right to the health professional to override the someone's view and wishes. Means we can't force for the taking decision of the patients, but we can suggest our best. That is the this is the best for our patient. Okay. Then empowerment and advocacy. One of the important role of the midwife is the advocacy and autonomy. This is the empowerment, educating and supporting the one of the major role of the midwife, as well as the lying emphasis on public health and health promotion. Advocacy means speaking out of others someone's right. We speaking for someone's right and someone benefit. It is considered useful in the situation where the client have been unable to make their own choices or anyone else is no one is listening him or her, but we can speak among of them or someone else decision. Okay, so in that case it means speaking up for the what the person want to happen. So in that case we think about the patient's benefit. Okay, health as a basic right for all. Women often lack basic human rights because they are viewed as less than human, less than person by many society. But the maternal death and disability are tragic example of this because we are not thinking about the patient. If the midwife or if any person is thinking about the patient first, then this kind of the death and maternal death or newborn death we can prevent it. Okay, so not as a producer of a child or sexual claimant. That they must be given the same status as men in a society. Women must also demand equal treatment and equal right for the health and well-being, like some ethical issues like the conceptus issues, IVF, surrogate mother, abortion, fetal tissue, okay, resuscitate, continuation, number of procedure as a child. So these kind of the ethical issues suffer to the mother and newborn also. Okay, so this is all are the ethical issues, ethical and legal issues of the obstetrical and midwife. By here I will stop. If you have any doubt, you can ask me later in next session. Thank you.